Stop scrolling. Look at me. My name is John. Think about the most stressful place you can be in a foreign country. It's not the airport. It's not the supermarket. It's the hospital. When you are sick, when you are in pain, or when someone you love needs help, language becomes everything. You need to explain your symptoms. You need to understand the doctor. You need to read the prescription. If you cannot communicate in a hospital, your health is at risk. Today, we are going to do something very important. We are going to walk through a hospital together, from the moment you walk into the emergency room to the moment you are discharged with your medicine. 1,000 medical sentences. You will learn to describe pain. You will learn to understand nurses. You will learn to talk to pharmacists. This is not just English. This could save your life. I want you to imagine you are sitting in a waiting room. Repeat every sentence. Feel the urgency. By the time we leave this hospital, you will be able to handle any medical situation with confidence. Take a deep breath. Your health journey starts now. I need to go to the hospital immediately. I need to go to the hospital immediately. Please call an ambulance. Please call an ambulance. I feel very dizzy and weak. I feel very dizzy and weak. My chest hurts when I breathe. My chest hurts when I breathe. I think I am having a heart attack. I think I am having a heart attack. Please stay on the line with me. Please stay on the line with me. The ambulance is on its way. The ambulance is on its way. I can hear the sirens now. I can hear the sirens now. The paramedics are here. The paramedics are here. They are putting me on a stretcher. They are putting me on a stretcher. They are loading me into the ambulance. They are loading me into the ambulance. A paramedic is checking my blood pressure. A paramedic is checking my blood pressure. She is asking me about my pain level. She is asking me about my pain level. On a scale of 1 to 10, my pain is an 8. On a scale of 1 to 10, my pain is an 8. She puts an oxygen mask on my face. She puts an oxygen mask on my face. The ambulance is driving very fast. The ambulance is driving very fast. We have arrived at the hospital. We have arrived at the hospital. They are rushing me through the emergency doors. They are rushing me through the emergency doors. A nurse is asking for my name. A nurse is asking for my name. I tell her my name is John. I tell her my name is John. She asks for my date of birth. She asks for my date of birth. I tell her my date of birth. She asks if I have any allergies. She asks if I have any allergies. I am allergic to penicillin. I am allergic to penicillin. She writes that down on my chart. She writes that down on my chart. They wheel me into a treatment room. They wheel me into a treatment room. A doctor comes in to see me. A doctor comes in to see me. He asks me where the pain is located. He asks me where the pain is located. I point to my chest. I point to my chest. I tell him the pain is sharp and stabbing. I tell him the pain is sharp and stabbing. He asks if the pain radiates anywhere else. He asks if the pain radiates anywhere else. Yes, it goes down my left arm. Yes, it goes down my left arm. He asks if I have been feeling nauseous. He asks if I have been feeling nauseous. Yes, I feel like I am going to vomit. Yes, I feel like I am going to vomit. He tells a nurse to start an IV. He tells a nurse to start an IV. The nurse cleans my arm with alcohol. The nurse cleans my arm with alcohol.
She inserts the needle gently. She inserts the needle gently. It hurts a little bit. It hurts a little bit. She tapes it down so it stays in place. She tapes it down so it stays in place. The doctor orders some blood tests. The doctor orders some blood tests. A phlebotomist comes to draw my blood. A phlebotomist comes to draw my blood. She ties a tourniquet around my arm. She ties a tourniquet around my arm. She asks me to make a fist. She asks me to make a fist. She inserts the needle into my vein. She inserts the needle into my vein. She fills several vials with blood. She fills several vials with blood. She puts bandages on the puncture site. She puts bandages on the puncture site. The doctor says they're going to do an EKG. The doctor says they're going to do an EKG. A technician comes in with the machine. A technician comes in with the machine. She asks me to lift my shirt. She asks me to lift my shirt. She places small stickers on my chest. She places small stickers on my chest. She attaches wires to the stickers. She attaches wires to the stickers. The machine starts printing a graph. The machine starts printing a graph. The doctor looks at the results. The doctor looks at the results. He says my heart rhythm looks okay for now. He says my heart rhythm looks okay for now. I feel a little relieved. I feel a little relieved. They are going to admit me for observation. They are going to admit me for observation. Being admitted to a room. A nurse comes to take me to my room. A nurse comes to take me to my room. She pushes my wheelchair down the hall. She pushes my wheelchair down the hall. We get into the elevator. We get into the elevator. We go up to the 4th floor. We go up to the 4th floor. We enter a semi-private room. We enter a semi-private room. There is another patient in the bed by the window. There is another patient in the bed by the window. I get the bed by the door. I get the bed by the door. The nurse helps me get into the bed. The nurse helps me get into the bed. She hands me a call button. She hands me a call button. She says to press it if I need anything. She says to press it if I need anything. She hangs a bag of fluids on my IV pole. She hangs a bag of fluids on my IV pole. She connects it to my IV line. She connects it to my IV line. She checks my vital signs again. She checks my vital signs again. My blood pressure is still a little high. My blood pressure is still a little high. My temperature is normal. My temperature is normal. My oxygen level is good. My oxygen level is good. She writes everything on the whiteboard. She writes everything on the whiteboard. The whiteboard has my nurse's name on it. The whiteboard has my nurse's name on it. Her name is Lisa. Her name is Lisa.
You are halfway through your hospital stay. The doctor has run some tests, and you are waiting for results. If this medical English is helping you feel prepared for an emergency, please help me reach more people. Hit the like button right now. It tells the algorithm that this content is important. And if you want to be ready for any health situation, make sure you are subscribed. Now, let's continue with your recovery. The doctor will come back later to check on me. The doctor will come back later to check on me. She pulls the curtain around my bed for privacy. She pulls the curtain around my bed for privacy. I am alone now. I am alone now. I look around the room. I look around the room. There is a television on the wall. There is a television on the wall. There is a small bathroom next to my bed. There is a small bathroom next to my bed. I feel tired. I feel tired. I close my eyes and try to rest. I close my eyes and try to rest. Talking to the nurse. A few hours pass. A few hours pass. Nurse Lisa comes back to check on me. Nurse Lisa comes back to check on me. She asks how I am feeling now. She asks how I am feeling now. I tell her the chest pain is a little better. I tell her the chest pain is a little better, but I still feel weak. But I still feel weak. She says that is normal. She says that is normal. She asks if I need anything for pain. She asks if I need anything for pain. I say, yes, please. I say, yes, please.
She says she will bring me some medication. She says she will bring me some medication. She asks if I am hungry. She asks if I am hungry. They have a liquid diet for me tonight. They have a liquid diet for me tonight. I can have broth, juice, or gelatin. I can have broth, juice, or gelatin. I ask for some chicken broth. I ask for some chicken broth. She says she will bring it soon. She says she will bring it soon. She comes back with the pain medication. She comes back with the pain medication. She scans the barcode on my wristband. She scans the medication package. She gives me a small cup with 2 pills. She gives me a small cup with 2 pills. She gives me a cup of water. She gives me a cup of water. I take the pills. I take the pills. She asks if I need help to use the bathroom. She asks if I need help to use the bathroom. I say I am okay for now. I say I am okay for now. She adjusts the pillows behind my head. She adjusts the pillows behind my head. She makes sure my call button is within reach. She makes sure my call button is within reach. She tells me to rest. She tells me to rest. Meeting the doctor. The next morning, the doctor comes in. The next morning, the doctor comes in. He is with a group of medical students. He is with a group of medical students. He asks how I am feeling today. He asks how I am feeling today. I say I feel much better. I say I feel much better.
The chest pain is gone. The chest pain is gone. He listens to my heart with a stethoscope. He listens to my heart with a stethoscope. He asks me to take deep breaths. He asks me to take deep breaths. He listens to my lungs. He listens to my lungs. He says my breathing sounds clear. He says my breathing sounds clear. He looks at my chart. He looks at my chart. He says my blood work came back. He says my blood work came back. My enzyme levels are normal. My enzyme levels are normal. That means I did not have a heart attack. That means I did not have a heart attack. I feel a huge wave of relief. I feel a huge wave of relief. He says it was probably severe anxiety. He says it was probably severe anxiety. Or it could have been indigestion. Or it could have been indigestion. But they want to keep me one more night. But they want to keep me one more night. They want to do a stress test in the morning. They want to do a stress test in the morning. I agree to stay. I agree to stay. He says goodbye and leaves with the students. He says goodbye and leaves with the students. The hospital routine, daily life. I am feeling bored just lying in bed. I am feeling bored just lying in bed. I turn on the television. I turn on the television. I watch a morning news show. I watch a morning news show. A food service worker brings me breakfast. A food service worker brings me breakfast.
She puts the tray on my bedside table. She puts the tray on my bedside table. She asks if I need anything else. She asks if I need anything else. I say no, thank you. I say no, thank you. I look at the tray. I look at the tray. There is oatmeal, a banana, and tea. There is also a small carton of milk. There is also a small carton of milk. I eat my breakfast slowly. I eat my breakfast slowly. It is not very good, but I am hungry. It is not very good, but I am hungry. A janitor comes in to clean the room. A janitor comes in to clean the room. He mops the floor. He mops the floor. He empties the trash can. He empties the trash can. He asks if I need fresh linens. He asks if I need fresh linens. I say, yes, please. I say, yes, please. He gives me a clean blanket and pillowcase. He gives me a clean blanket and pillowcase. I try to make my bed. I try to make my bed. My roommate is watching a game show. My roommate is watching a game show. He is an older man. He is an older man. He had hip surgery yesterday. He had hip surgery yesterday. We start talking a little bit. We start talking a little bit. He asks why I am here. He asks why I am here. I tell him about the chest pain. I tell him about the chest pain. He says he hopes I feel better soon. He says he hopes I feel better soon.
It is nice to have someone to talk to. It is nice to have someone to talk to. The next morning, an orderly comes to get me. The next morning, an orderly comes to get me. He takes me to the cardiology department. He takes me to the cardiology department. I am going for my stress test. I am going for my stress test. A technician explains the procedure. A technician explains the procedure. I will walk on a treadmill. I will walk on a treadmill. They will monitor my heart. They will monitor my heart. The speed will increase gradually. The speed will increase gradually. They put electrodes on my chest again. They put electrodes on my chest again. I start walking on the treadmill. I start walking on the treadmill. The treadmill gets faster. The treadmill gets faster. The incline gets steeper. The incline gets steeper. I am breathing heavily. I am breathing heavily. My legs are getting tired. My legs are getting tired. The technician asks how I am feeling. The technician asks how I am feeling.
I say I am a little short of breath. I say I am a little short of breath. She asks if I feel any chest pain. She asks if I feel any chest pain. I say no chest pain. I say no chest pain. She says I can stop now. She says I can stop now. The test is over. The test is over. I sit down to rest. I sit down to rest. They monitor my recovery. They monitor my recovery.
After a few minutes, she says the test looks good. After a few minutes, she says the test looks good. My heart handled the exercise well. My heart handled the exercise well. They take me back to my room. They take me back to my room. Discharge planning. Later, the doctor comes back. Later, the doctor comes back. He has good news. He has good news. I can go home today. I can go home today. He says my heart is healthy. He says my heart is healthy. He thinks the pain was musculoskeletal. He thinks the pain was musculoskeletal. Maybe I pulled a muscle. Maybe I pulled a muscle. But he gives me some prescriptions. But he gives me some prescriptions. Just to be safe. Just to be safe. He gives me a prescription for pain relievers. He gives me a prescription for pain relievers. He gives me a prescription for antacids. He gives me a prescription for antacids. He tells me to follow up with my regular doctor. He tells me to follow up with my regular doctor. He says I should come back if the pain returns. He says I should come back if the pain returns. I thank him for everything. I thank him for everything. He shakes my hand and leaves. He shakes my hand and leaves. A discharge nurse comes in. A discharge nurse comes in. She has a lot of papers for me. She has a lot of papers for me. She explains my discharge instructions. She explains my discharge instructions. She tells me what medications to take. She tells me what medications to take. She tells me how often to take them. She tells me how often to take them. She tells me about possible side effects. She tells me about possible side effects. She gives me a written summary. She gives me a written summary. She asks if I have any questions. She asks if I have any questions. I ask about driving. I ask about driving. She says I can drive tomorrow. She says I can drive tomorrow. I ask about returning to work. I ask about returning to work. She says I can go back on Monday. She says I can go back on Monday. She asks if I need a ride home. She asks if I need a ride home. I tell her my wife is coming to pick me up. I tell her my wife is coming to pick me up. She tells me to wait in the discharge lounge. She tells me to wait in the discharge lounge. I need to remove my hospital gown. I need to remove my hospital gown. I put on my own clothes.
I put on my own clothes. It feels good to wear my own clothes again. It feels good to wear my own clothes again. I pack up my few belongings. I pack up my few belongings. I put my phone and charger in my bag. I put my phone and charger in my bag. I press the call button. I press the call button. A nurse comes to remove my IV. A nurse comes to remove my IV. She pulls the tape off gently. She pulls the tape off gently. She pulls the IV line out. She pulls the IV line out. She puts pressure on the site with gauze. She puts pressure on the site with gauze. She tells me to hold it for a minute. She tells me to hold it for a minute. She puts a bandage on it. She puts a bandage on it. I am officially disconnected. I am officially disconnected.
I am free. I am free. Leaving the hospital. A volunteer comes with a wheelchair. A volunteer comes with a wheelchair. Hospital policy says I must be wheeled out. Hospital policy says I must be wheeled out. I sit in the wheelchair. I sit in the wheelchair. She pushes me through the long hallways. She pushes me through the long hallways. We go down the elevator. We go down the elevator. We go to the main lobby. We go to the main lobby. I see my wife waiting by the entrance. I see my wife waiting by the entrance. She looks relieved to see me. She looks relieved to see me. She hugs me carefully. She hugs me carefully. She asks how I am feeling. She asks how I am feeling. I tell her I feel okay. I tell her I feel okay. Just tired. Just tired. We walk to the car. We walk to the car. I get in the passenger seat. I get in the passenger seat. It feels strange to be in a car again. It feels strange to be in a car again. We drive away from the hospital. We drive away from the hospital. I look back at the building. I look back at the building. I am so happy to leave. I am so happy to leave. I go to the counter with my prescriptions. I go to the counter with my prescriptions. I hand them to the pharmacist. I hand them to the pharmacist. He says they will be ready in 20 minutes. He says they will be ready in 20 minutes. We walk around the store while we wait. We walk around the store while we wait. I buy some magazines to read at home. I buy some magazines to read at home. My wife buys some snacks. My wife buys some snacks. We go back to the pharmacy counter. We go back to the pharmacy counter. The pharmacist calls my name. The pharmacist calls my name. He explains how to take the medication. He explains how to take the medication. He says take 1 pill twice a day. He says take 1 pill twice a day. He says take the other one at night. He says take the other one at night. He asks if I have any questions. He asks if I have any questions. I ask if I can take them with food. I ask if I can take them with food. He says yes, it is better with food. He says yes, it is better with food. He puts the bags in a paper bag. He puts the bags in a paper bag. I pay for the medication. I pay for the medication. My insurance covers most of the cost. My insurance covers most of the cost. I only have a small copay. I only have a small copay. We leave the pharmacy. We leave the pharmacy. We finally go home. We finally go home. Home recovery. I walk into my house. I walk into my house. Everything looks the same. Everything looks the same. But I feel different. But I feel different. I appreciate being home more now. I appreciate being home more now. I sit on my own couch. I sit on my own couch. It is so comfortable. It is so comfortable. My dog comes to greet me. My dog comes to greet me. He wags his tail.
He wags his tail. I pet him gently. I pet him gently. My wife makes me a cup of tea. My wife makes me a cup of tea. I sit and relax. I sit and relax. I am not in a hospital bed. I am not in a hospital bed. There are no beeping machines. There are no nurses coming in. It is quiet. It is peaceful. I think about my experience. I think about my experience. It was scary. It was scary. But I handled it. I handled it. I communicated with the doctors. I communicated with the nurses. I understood what they said. I understood what they said. I was able to explain my pain. I was able to explain my symptoms. My English was good enough. My English was good enough. It was good enough for a hospital. It was good enough for an emergency. I feel proud. I feel proud. I feel grateful. I feel grateful.
Grateful for my health. Grateful for the doctors. Grateful for my wife. Grateful for my English. The patient presented with acute shortness of breath and tachycardia. The patient presented with acute shortness of breath and tachycardia. We need to administer epinephrine immediately due to anaphylaxis. We need to administer epinephrine immediately due to anaphylaxis. The biopsy results came back negative for malignancy. The biopsy results came back negative for malignancy. I am concerned about the possibility of a deep vein thrombosis. I am concerned about the possibility of a deep vein thrombosis. We need to monitor his blood glucose levels every 2 hours. We need to monitor his blood glucose levels every 2 hours. She is scheduled for an MRI of her brain tomorrow morning. She is scheduled for an MRI of her brain tomorrow morning. The side effects of this medication may include drowsiness and dry mouth. The side effects of this medication may include drowsiness and dry mouth. We need to intubate the patient to protect his airway. We need to intubate the patient to protect his airway. The surgeon will perform a laparoscopic cholecystectomy. The surgeon will perform a laparoscopic cholecystectomy. The patient is in stable condition and resting comfortably. The patient is in stable condition and resting comfortably. I need you to sign this consent form for the procedure. I need you to sign this consent form for the procedure. Do you have a living will or advance directive? Do you have a living will or advance directive? The prognosis for this type of cancer is improving. The prognosis for this type of cancer is improving. We are going to start chemotherapy next week. We are going to start chemotherapy next week. The physical therapist will work with you on your mobility. The physical therapist will work with you on your mobility. You need to keep the surgical incision clean and dry. You need to keep the surgical incision clean and dry. Watch for signs of infection like redness or swelling. Watch for signs of infection like redness or swelling. If you have a fever, call the doctor immediately. If you have a fever, call the doctor immediately. The cardiologist recommended an angioplasty. The cardiologist recommended an angioplasty. I need a second opinion before I agree to surgery. I need a second opinion before I agree to surgery. Health is the most important thing. Health is the most important thing. Without health, nothing else matters. Without health, nothing else matters. Money, work, success, none of it matters if you are sick. I learned that this week. I learned that this week.
I need to take better care of myself. I need to eat healthier. I need to exercise more. I need to reduce my stress. I need to sleep more. I need to drink more water. I need to listen to my body. I need to listen to my body. If something feels wrong, I need to get help. If something feels wrong, I need to get help. I cannot ignore the signs. I cannot ignore the signs. And I need to keep practicing my English. And I need to keep practicing my English.
Because you never know when you will need it. Because you never know when you will need it. You never know when you will need to say, I have chest pain. You never know when you will need to say, I am allergic to penicillin. You never know when you will need to say, help me, please. These words are not just words. These words are tools. These words are lifesavers. Final moments in the hospital. Goodbye. I am home now. I am home now. But I will never forget the hospital. But I will never forget the hospital. I will never forget Nurse Lisa. I will never forget the doctor. I will never forget my roommate. They helped me. They helped me. And I was able to talk to them. And I was able to talk to them. In English. In English. A language that is not my first language. A language that is not my first language. But I used it. But I used it. And it worked. And it worked. If you are learning English, do not stop. If you are learning English, do not stop. Practice every day. Practice every day. Practice the hard words. Practice the medical words. You never know when they will save you. You never know when they will save you. My name is John. My name is John. And this was your hospital stay. And this was your hospital stay. I am glad you are okay. I am glad you are okay. I am glad we made it through together. I am glad we made it through together. Take care of yourself. Take care of yourself. Get some rest. Get some rest. And I will see you in the next lesson. And I will see you in the next lesson. Goodbye. Goodbye. We are being discharged. The paperwork is signed, and you are ready to go home. You have learned 1,000 hospital sentences. If this video could help someone you love who is learning English, please share it with them. It might help them in an emergency. And if you haven't subscribed to join me for more life-saving lessons, hit that button now. Now, let's walk out of these hospital doors together and finish strong.